Hi there, this is my self-reflection video for Clinical Internship 3 for my off-campus internship at Sunnybrook. Basically, I'm just going to be going through the variables on the laptop and just reflecting on them. The reason why I waited so long for my self-reflection is because I wanted to see how my experience was over a couple of weeks, not over just, 1 or 2 weeks, and get a false perception of the internship. So I wanted to see how it spanned out over a couple of treatments and weeks. So first one is prior learning experience with the mental health population. I don't really have any prior learning experiences with the mental health population, at least nothing that I know of, because there's some patients that don't say or disclose certain information with you in regards to anxiety or depression. So prior learning experience, not that I know of. I haven't had anybody come in to on-campus internship with any mental health concerns. And I haven't treated anybody or practiced on anybody at home with mental health concerns. So it is a fairly new topic for me. Clinical experience. We did have that one on-campus internship class where it was a mental health focus. And then that was our only experience with that. It was students that were experiencing stress or anxiety, and also students outside from different schools, and the general population coming in with that. I had a student that just experienced a lot of stress that kind of fell under the category of mental health, but I haven't had anybody with anxiety or depression or schizophrenia, any psychosis, anything like that. I have not had experience with. Personal experience, that depends. Like, personal experience in regards to massage, no. Have I had personal experience with mental health issues? Yes, some of my friends from work have mental health concerns that they are concerned about, and they are getting treated. So yeah, I have a personal experience with it. It has not been a negative one. People with mental health issues are just treated like normal people. Yeah, don't really have any negative personal experience with it. I do have some, but not anything to be concerned about, or anything that would kind of hinder my ability to perform in massage therapy clinical internship 3. So, emotions, attitudes, values, assumptions, and beliefs. Emotions going into first week, I was extremely nervous, again, because I don't have a lot of proper exposure to mental health concerns, especially because it was in a hospital. I think I had a false narrative in my head that it would be way worse than it actually is. Of course, the OTs and nurses there, and our instructor are really accommodating. They don't give anybody to us that we can't handle. So first week going in, I was very nervous. My assessments weren't really up to par, and neither was my treatment, just because I was kind of getting a feel of the environment rather than being so patient. It was patient-centered, but not as patient-centered as it is now, because I just wanted to get a feel and just get comfortable with the environment before I started to really kind of treat with confidence. Strength and weaknesses. Weaknesses, I do get nervous with different populations, especially populations I have not experienced before. So, for example, in my previous year, we had infants and babies, and I was really nervous with that because I didn't really know how to, I guess, act or treat infants, because I've never had the experience to. I didn't really know how to behave, or like if I could just like grab the mom's baby, or so it was that was one of my main weaknesses, and still is. I still get a little bit nervous for something I'm not familiar with. Strengths, I'm very adaptable. So yes, I do get nervous, but after a week, I'm pretty adaptable. I kind of get into the groove, get the feel of it, and I start treating as if they were my actual clientele, if I was an actual RMT. Strengths, another strength I have, I would like to say I'm pretty personable. I like to talk to people. So it's kind of my more like security blanket, but it also makes it less awkward. I talk about things kind of, about the treatment, but also, about other things such as, the weather, simple things, just to kind of get that awkward stage over with. Confidence level. At the beginning, I wasn't so confident, especially because my treatment and my assessment weren't that great, in my opinion. So I kind of was really hard and down on myself. But over the past couple of weeks, my confidence level has grown. So I do feel a lot more confident now, coming into clinic, or in my future career, treating patients with mental health concerns. Um, yeah, and then reflect on all the weeks of your internship. So again, um, I was very nervous at first, especially because I didn't know what to expect. Because a lot of these people, not only have mental health concerns, but they also have, other physical, emotional, um, concerns that they are dealing with as well. So I was kind of very nervous. I wasn't really as prepared as I would like to be, for that internship. So a little story, a little background. I had a patient, um, that was very, um, very quiet, very closed. She seemed that she would have really bad days one day and then really good days, the next week. The first time I saw her, it was only second week, so I was still a little bit nervous. Um, the OT had to the OT on shift had to help, this patient in because, she has a hard time walking. She experienced an immense amount of pain everywhere. She had an MBA, a couple of years prior, so, a lot of kind of ridiculous symptoms, a lot of pain, and this patient needed a lot of modifications during treatment as far as, pressure, positioning. We had to switch up positioning a lot of times, frequent breaks. So yeah, it was kind of a lot going on at once. Um, so that was kind of a lot for me, for the second week, of course. And then that will kind of be my clinical experience that had the lasting impact on me. But it was, it was a good learning experience because I do need to be exposed to, situations that are a little bit more, intense and a little bit harder. Um, but anyway, even though it was kind of difficult at first, it was nice, to kind of continuously work with this patient because then I could see each week how she was progressing, and she was not only mentally feeling better, as she told me, but she was also physically feeling better, and you can see it with the way she was standing and the way, her facial expressions were. Sorry, she seemed very, sure of herself, and she seemed, more calm than she did the previous week. So it was definitely nice to see. And, it was funny because at first I didn't think I would like this, rotation, if I'm going to be completely honest. I got the email saying that I'm going to be one of the students at Sunnybrook, and I kind of, I did a big sigh, and, because I thought it would be hard for me. It's because I'm not really comfortable with, new situations, and I didn't have experience with it before, so definitely, I wasn't very excited for it. But it's interesting because over the past couple weeks, I think we only have 2 to 3 weeks left. I actually really learned to like going to Sunnybrook and, participating in these, off-campus internships. I learned to, grow, and I'm really, grateful that I got the experience to work with this population. It helped me come over my fears, and then it helps me in the future become a better therapist. Thank you for listening.